eye movement testing as a way to help determine one, if you've suffered a concussion, but two, to also help you get a customized treatment plan. Now, the first question people often have is, well, I don't notice any symptoms with my eyes, so do I really need the testing? And the answer is absolutely yes, because our eyes are such a good window into the health of our brain. It's not necessary to have blurry vision or double vision to have issues with your eye movements. Now, on the other side, as our eyes are such a good window into the health of our brain, did you know that your brain uses 25 to 30% of your entire body's energy? Okay, so that is a tremendous amount. So it's actually very common because we are such visually dominant creatures that even if you don't notice blurry vision, double vision, the more you try to focus, the more you try to concentrate, maybe you're working on computers or you're driving, other things like that. And then you're like, man, I feel my symptoms are getting worse. Here comes my headache. Here comes that neck pain that's always back here. I've got some pressure here. My word finding becomes off. My mood and irritability becomes worse. That can all be from issues with your eyes. Now, before we get into the eyes, we are going to review what are some of the actual symptoms that occur with a concussion. So there's a lot more than this, okay? But what we're going to start off with is concussion symptoms such as headaches, neck pain, poor concentration. So people often find they have got newfound ADHD. They're more of a squirrel now than they used to not be. Mood changes. So this could be depression, anxiety, irritability, quick to anger. Many of my patients who've previously been on psych meds for depression can have their meds changed, but yet they'd been on the same med for 2, 3, or even 4 years before that occurred. And now all of a sudden with the concussion, they need a different medication or a stronger one. Blurry vision is also very common, where people feel their vision's changing on them throughout the day and they're wondering if they should go to the eye doctor. Sometimes the answer is yes, other times it's not actually appropriate. Fatigue, as we already talked about, the brain uses 25 to 30% of the entire body's energy. So with a concussion, it's very common that as the day goes on, your symptoms get worse and worse and worse. And for those of you that are still working while battling a concussion, you'll often notice that Monday or Tuesday is your best day. And then as the week goes on, you'll gradually get worse and worse, earlier and earlier in the day. And then you spend all weekend recovering to repeat the same vicious cycle again. So let's help you get out of that. Also, brain fog. Now, people describe brain fog differently. Some people, this is zoning out. Others, it's problems with finding the words they're looking for. Others, they just feel like their brain's not clicking at the speed it should. And then dizziness is also another very common symptom where people can just feel like things are shifting left and right on them, rocking forward and back. And overall, they're just not feeling the way they should. Beyond this, we could go into insomnia and much more. But these are the most common symptoms with a concussion. And it's very important that when you diagnose a concussion, you only need 2 of these that are either new or worsened since before the injury occurred. So you don't have to have all of these, and you definitely don't have to lose consciousness. You definitely don't have to be vomiting and throwing up all over the place. So now that we've addressed concussion symptoms, why eyes are important, what does a eye movement assessment look like? Okay, so you'll often hear the term oculomotor is really the same for eye movements. Now, the gold standard for testing is using what's called video oculography or video nystagmography. As you'll see here, we've got goggles on their head, and this is me reviewing their results. But what happened in this test is they're looking at targets. Now, the target can be stationary, it can be moving left and right, it can be shifting from one spot to the next. This lets us identify how different parts of the brain are functioning, because even though eye movements use a considerable portion of the brain for each and every task, it biases and breakdowns in certain movements lets us know more specifically about certain parts of the brain. The other part is, even if you do well on this test, and if it makes you feel worse, that also is highly suggestive of a concussion or a mild traumatic brain injury. And lastly, many people, even though this test is only 30 minutes, often leave very tired and worn out. And it goes back to our brain is inefficient. It doesn't produce and use energy. And this is the way it should. And our eyes demand a ton of energy. So ultimately we feel worse. So what does a recording look like? So this is someone looking straight, and then they're going to move their eyes to the left. And we want to say, okay, are you able to keep your eyes still, or are they shifting? And when you watch this, you're going to see a lot of shifting and oscillating back and forth. Okay. There's a certain amount that's considered normal, but at that amount, it's definitely not normal. Common symptoms I do see when this is off is focus and concentration, memory, brain fog, neck pain, headaches, fatigue, and other things like that. Next, this is someone tracking left and right. So we want to say, okay, are you able to move your eyes nice and smooth, or is it more kind of glitchy and skipping? And as you'll be able to see here, there's definitely a lot of glitching. There's a lot of skipping. So this is not what we'd consider a normal eye movement test either. Now you may be wondering, wow, that's crazy, man. Like, they've got to feel really bad. Yes, this person did feel bad, but they did not perceive their eyes are doing this. And this is why everyone should have their eye movements tested if there's any suspicion of concussion at a high level, because you will not perceive your eyes doing this in most cases. Okay. Maybe I get 10%, upwards of 20 tops that realize they're even having issues. Most people will tell you after they perform the testing, how did you do? Oh, I did really well. You know, I definitely had no issues with that. And then I'll show them their videos and they're like, oh, ooh, that's way different than I thought I did. Here's going up and down. So as you'll see, this is anything but smooth up and down. There's a lot of left and right. If you almost want to view it as like zigzag movements, that's considerably off as well. And once again, this is testing that needs to be done on everyone if you've potentially suffered a concussion. And if you're playing sports, you want to have this testing done before the season. So that way you know what your baseline is. If you don't know what your baseline is, you can get back to a symptom baseline, but you may not be back to a functionality baseline. The reason why it's functionally important to get to that level is that is your long-term brain health. Our body and our brain will compensate for us. We don't want you to break down as you age, which routinely happens. Now, the last thing we want to look at when we talk about eye movements is something called vergence. So at this point in time, I'm going to stop sharing my screen. And when we look at vergence, vergence is something coming towards and away from us. Okay. So what that means is, so you've got a thumb, you've got something that has a letter on it, and it's going to come towards you and back out. We actually want to measure when does it first become blurry, and we also want to measure when does vision become double. Now, not everyone will experience double vision. Some people, they'll have a break in their eyes where as they're coming in, the eyes will look boom. And they won't even realize they're double, but that also would be an issue with convergence. Normal convergence is really 10 centimeters or less. Some of the research is 5. So it really varies depending on the research you look at. But needless to say, convergence issues are very common following a concussion, but I don't want you to think just about convergence issues. That tends to get more attention, but there can also be what's called divergence issues. So convergence is when it's coming towards you. Divergence is when it's going away. Problems with your eye, your brain controlling those eye movements and either coming towards or going apart can also occur with a concussion. So that's a really good introduction into the eye movements that you want to have evaluated as part of a concussion assessment. There are a few beyond that that we have not covered today. But with this information, you're going to start getting a better picture of why you're still struggling with concussion issues and can get a customized plan. And once again, I do emphasize a customized plan because imagine you do great at one part of that testing and then you don't do well on others. You will likely need a different treatment plan than someone that is vice versa, right? They do better on a part you did worse on, and then they do worse on a part you did good on. So it really is important to customize it. And then lastly, anytime you do concussion treatment, you really want to address all the aspects of a concussion. Concussion is not just one thing, it's different for each individual. And the biggest mistake that I see, and I do want to offer caution, is they'll go and do vestibular therapy or vision therapy. Now, imagine concussion recovery is like a 5 or 6 piece puzzle. Vision therapy, one piece. Vestibular therapy, one piece. So if you're only doing one of those, one piece will never complete a puzzle. And that's why so many people I work with who are like, but I've already done that, and then they didn't get better. But then when it's pieced together with the other aspects that need to be addressed, now all of a sudden they're getting results they weren't getting. And it's because we weren't trying to make one piece everything. So different pieces that should be considered. And if you've got questions on this, you can definitely reach out to my team. Is you've got vision, so the eye movements we did, you've got vestibular, you've got cognitive, you've got energy, you've got inflammation, you've got sleep, you've got nutrition, right? And the list really goes on and on and on. So there's multiple pieces to the puzzle that need to be looked at and evaluated. And then with that information, the right plan can be put together for you. And once again, that is why I see so many people who fail other places. And yet when they come in, they're getting better. And it's because we're not trying to make one piece the entire puzzle. We recognize that there are multiple pieces to each puzzle, and there are going to be parts that matter more to your puzzle than someone else's, but you don't know it if you don't actually look and evaluate it. I hope you found all this information useful. Please comment and let me know. And if you'd like to learn more, you can also visit drspencerzimmerman.com. Until next time, this is Dr. Z. I'm known as the Brain Guy.